I am Dr. Dhiman Mandal, physician, practicing physician in West Bengal. Today we will discuss on hypertension, and we will understand how the hypertension occurs and how it affects us and how to prevent it. So we are starting our discussion on the heading of understanding hypertension. Generally, everyone would like to have healthy or normal blood pressure. But what exactly hypertension is? So for that, we have to uh, discuss about how the hypertension occurs. Theoretically, hypertension is, by definition, it is a lateral pressure exerted on the wall of a artery or vein. But for better understanding, we'll discuss it like this: that uh, when our heart beats, it pumps blood into the blood vessels. This creates pressure against the wall of blood vessels. This is called the blood pressure. Normally, in healthy person, it fluctuates or rises or falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health issues. In general, persistent increase in blood pressure higher than normal pressure is known as hypertension. So, high blood pressure usually develops over time. It can happen because of unhealthy lifestyle. For example, not having regular physical activity, obesity, smoking, high alcohol consumption, and etc. There are some other risk factors that also increases the risk of hypertension in our life, such as age. When people gets older, the arteries become stiffened and narrow as excess fat builds on the wall of them. If there is a family history of hypertension, like our father or mother, or directly in our blood relation, someone suffers from hypertension, we can also suffer from it. Excess salt intake, also known to cause raised hypertension. Not eating enough food with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed foods and fatty foods increases fats throughout the body and makes the heart work harder to push blood through our body, hence causing blood pressure to rise. On the other hand, lack of physical activity, which is also linked to obesity, are further causing high blood pressures. And the last but not the least is stress. Increase in stress in our regular healthy environments, work environments, or home environments can increase blood pressure also. Moving on, hypertension doesn't have any particular sign or symptom. So it's known as silent killer. But people who are at risk of several diseases like cardiovascular problems or kidney failure or stroke or eye damages that can lead to blindness also, which may be caused by hypertension. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether the person is suffering from hypertension or not. So we'll discuss it further. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of the symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now, let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 upon 80 millimeter of mercury, or it can also read as 120 over 80 millimeter of mercury. Here, the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between beats. If blood pressure level is or more than 140 upon 90 millimeter of mercury, then the person is having hypertension. If person have BP levels higher than this, then he or she might have risk of developing serious heart disease. The risk can be prevented and reduced by taking steps towards the healthier lifestyle skills, such as one is regular exercises, second is healthy diet, third is quit smoking, and fourth is regular blood pressure monitoring, fifth is stress management, and sixth, not the least, adherence to medicine. We have to continue with our medications. If those medicines are prescribed by doctors, we should adhere to it or to continue the medications. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need for medication. So let's look at the strategies one by one. We will go for a little elaboration by each point by point. First is regular exercise or physical activity. How do we do it? Exercise can be a drug-free approach to lower blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So, if heart has to work less to pump, the force on blood vessels will decrease and lower the blood pressure. In other case, as we all are aware, that age and weight gain are the two major risk factors for high BP. So, if the blood pressure is at a desirable level, like 120 upon 80 millimeter of mercury, then exercise can help prevent it from rising as you age. Regular exercise also helps you maintain a healthy weight, which, in my opinion, is an important way to control blood pressure. One should aim for at least 30 minutes of workout daily. High BP level can be reduced by doing regular structured exercise like brisk walking, jogging, and swimming, etc. Second point, we will elaborate on healthy diet. Diet also plays an important role in controlling blood pressure. A diet with high intake of vegetables or dietary fibers like fruits, whole grains is recommended for hypertensive patients. For lowering blood pressures or preventing hypertension through dietary intervention, one can adopt dietary pattern such as DASH diet or a Mediterranean diet, eating less saturated fat or total fat, getting plenty of potassium, limiting the amount of sodium in diet, and limiting alcohol consumption, obviously. DASH stands for dietary approach to stop hypertension diet. Eating a DASH diet that is rich in whole grain, fruits, vegetables, and low-fat dairy products and skims on saturated fats and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure, if that person is having high blood pressure. And the next point is on discussion on reduce our sodium intake in daily livelihood. Even a small reduction of sodium in diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeters of mercury. If you have high blood pressure, to decrease sodium in your diet, you can consider tips like one is read food labels. If you are eating processed foods and canned foods, you should choose low sodium alternative for the foods and beverages you normally buy. Second is eat fewer processed foods. You have to eat little of them. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing, so one can eat natural products. And last and not the least is don't add salt. You must not do it. Just 1 level teaspoon of salt has 230 milligram of sodium. So avoid adding salt to food. Use herbs or spices to add flavor to your food. And third is quit smoking. We have to quit our smoking habits. Smoking helps your blood pressure return to quitting smoking helps blood pressure return to normal. Quitting smoking also can effectively reduce your risk of heart diseases and improve your overall health. And the next point is regulating or monitoring your blood glucose by yourself. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients self-monitoring of their blood BP levels. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get a more complete picture of person's blood pressure reading at different times, like our morning BP or office BP, so on and so forth. Further helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during the clinic visits. Fifth is stress management. By learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure in a greater extent. Stress management technique include exercising, listening to music, focusing on something calm and peaceful, and meditating. And last, we already discussed and we'll elaborate on adherence to medicines. A medicine to lower blood pressure may be recommended by doctor. If your blood pressure is consistently high, usually at or above 140 by 90 millimeter of mercury, adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy body. Adapting healthy lifestyle can help us enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. We are coming to an end of our discussion. Thank you for listening to us.